Okay.
Ujiwanin, good afternoon. This is Kathy Chavers giving you an update this week. It's the week before New Year's, so I would first like to say that we are going to be doing a door-to-door distribution of handouts or information, hopefully about just up to 5 pages, with regards to any information regarding the pandemic, the COVID vaccine, or any other kind of updates we want to have. So that will be done on January 14th and January 28th. So anticipate some papers coming to your doors, going on the door-to-door distribution in Net Lake, Vermilion, and surrounding communities. We have an RTC meeting on January 6th at Net Lake, and that will be by Zoom. I'm happy to announce also we have no cases on the reservation and no one in isolation or quarantine. I want to give a big shout out to our community who's been doing an awesome job, excellent job by keeping the virus out of our community and doing the social distancing, masking, and taking care of themselves and their family members, because we're very fortunate to have no cases, especially when areas around us seem to be having surges. We're also going to give you a little update on some of the vaccine stuff that's been going on here at Bois Forte. We did distribute a plan that's been devised by the clinic and approved by the Tribal Council for how the vaccine is going to be distributed. The Pfizer vaccine was the first vaccine we received, and that was the one that had to be frozen at such severe temperatures. But most of our healthcare providers and emergency personnel, law enforcement, fire, all received those, and our chronic elders, or those deemed 65 and over that were at very high risk for the virus, received the vaccine. So they'll be getting their second shot next week sometime. We did receive our Moderna vaccines on last Wednesday, but however, due to the offices being closed, they are right now doing Moderna vaccines, and they do have a vaccine update which they've asked me to read here from the clinic. The priority list that the clinic is following is posted on the website earlier this month. The first part was the essential workers, which has been completed, and they will be getting the second shot of the Pfizer vaccine next week. Number 2 on our priority list was elders on reservation and high-risk elders as determined by clinic provider. Those will be called by the clinic. We have done quite a bit of that now, and so we are now going on to our 55 and older elders. The next one in line will be, after our elders are done, will be the Tribal Council. And then after that will be tribal government employees, which an email will be sent to our employees and appointments will be made as employees call in. And then it's open to all tribal members and then the public. The patient process they've asked me to read is, number 1, keep your appointment. If you miss it, you will then be placed on the waiting list and will be called when an appointment is available. Number 2, come in and get your shot once you keep your appointment. Number 3, after your shot, make your second appointment on the way out, because both shots require 2 appointments, 2 shots. Number 4 is to keep your second appointment. They want you to please keep in mind that the clinic does not have enough staff to speed up the vaccine distribution process. They continue to schedule appointments for regular patients as well. So be patient with the vaccine timeline, because the clinic can only provide so many injections per day. And the clinic is also doing COVID testing as well as providing routine medical clinic care to patients. Bois Forte is well ahead of many of the other tribes in the vaccine process and far ahead of the state of Minnesota and the rest of the U.S. Most people in the state and the U.S. will not have the opportunity to receive a COVID vaccine until midsummer, which is June of 2021. The clinic would like to thank you for your understanding and patience as we continue to navigate through this pandemic. And if you have any questions in regards to the vaccine, please call the clinics and ask to speak with the nursing staff. The Vermilion Clinic number is 218-753-2182, and the Net Lake Clinic number is 218-757-3650. Now, we know that there's been some questions or concerns about the vaccine. So there is a frequently asked question in myths about the vaccine that was given to the Vermilion residents, and we'll be posting on the website if we haven't already. But the first thing they want to know is the vaccine safe? The myth out there is that the COVID-19 vaccines are not safe because they were developed and tested too quickly. The fact is that companies did not bypass any safety protocols or performed inadequate testing. The fact is that COVID-19 vaccines have been proven are safe and over 90% effective in preventing an infection. And the manufacturers of those vaccines have had to follow those who had the vaccine for at least 2 months after vaccination. So the safety of the vaccine will continue to be followed and closely monitored by the CDC and the FDA, which is the Food and Drug Administration. The vaccine is free of animal origins. Think using eggs for the flu vaccine, and they are preservative free. The vaccine cannot give you COVID-19 because they're not using a live virus, which is making it non-infectious. COVID-19 vaccines have severe side effects. That's a myth. The fact is that there are short-term mild to moderate side effects, that 15% of people have experienced irritation at the site of the injection. Half have had a headache, chills, fatigue, muscle pain, fever lasting a day or two. But remember that the side effects tell you that the vaccine is working because you're having an immune response. So basically, there are some facts and myths out there, and we're trying to get that information out to you. My main concern, though, is that if you have a concern, ask a question, call the clinic, and make sure that you can get that question answered by our medical staff, because a lot of the stuff on the news or in the newspapers or whatever, sometimes we believe it and sometimes we don't. So get the facts from our medical providers or our nurses, because they've been very well trained and know the answers to your questions. The other thing we're thinking is that it might be a good idea, and we hope to be having that soon, where we'll have videos of an elder who received a vaccination, because everybody's reactions to the shot will be different. Some may not have any, some may have a slight headache, some may get a rash at the site, but it's going to be different. So we thought maybe if you heard some videos from some of our people who have gotten the vaccines, that might be helpful in making your determination if you're going to get the vaccine or not. We have received, like I said, the Moderna vaccine. We have received that from McKesson, and we will be having to reorder that now through McKesson. We did receive it from IHS at first. However, the next shipment we do have to get through McKesson rather than IHS. So we will be updating you as much as we can with regards to how the vaccines will be getting here. And main thing is call the clinics if you have a question. And your question hopefully will get answered by the staff there. The other thing I just want to say is that we really appreciate everything that everybody's done this past year. It's been a tough year. We know we're coming into a new year. Our State of the Band will be done by Zoom or virtual, but it will be taped, and we hope to have some of our COVID funding updates at that time. And we're very thankful that the stimulus package was signed by the president, because that enables us to spend out the money until another year. We don't have to rush, but also it's much needed in all communities with regards to the unemployment, the rental assistance, child care, everywhere. It's been an awful year, and we hope that a lot of the worst things are behind us, and there's new hope for us in the future with this vaccine, and new hope with a new administration coming in January with the new president-elect President Biden and Vice President Kamala Harris. So we have some positive things to look forward to. On behalf of the Tribal Council, I'd like to wish you all a Happy New Year, safe holidays. Please be safe. Please do not drink and drive. If you do plan to have a few cocktails, just be safe, wear your mask, social distance, do not attend large gatherings, just try to, be safe. And we've been showing within Indian country that it works. And with that, I'd like to say again, Happy New Year to everybody, and we will be doing another video next week with more updates. But we hope to be applying for some of the stimulus funding, and we'll try to get some information out to you by next week with regards to maybe a couple programs that we can come up with in the meantime, but I do have one comment to make regarding the stimulus package. There was no funding specifically for cities or tribal governments, and we can apply for some funding for education, rental assistance and what have you, but as far as tribally specific funding, there wasn't any, but we can apply for grants through the CARES Act. This last stimulus package, I shouldn't call it the CARES Act because it'll get confused with the last one. So with that, again, Happy New Year, everybody, and be safe, and we'll see you next year. Miigwech, have a good day.